I'm Bob Schrupp, physical therapist.
And I am Brad Heineck, physical therapist.
Wow, he's emphasizing that. Together, unless he doesn't even want me around anymore, we are the most famous physical therapists on the internet.
Yeah, and that's in our opinion, of course, but it could happen where I get to be the most famous someday.
We do have some unity here. We're both wearing our Jerry Garcia ties today. So
They probably noticed that right away.
yeah, they picked up on that.
Yeah.
So today, Brad, we're going to talk about the Tinetti Balance Assessment Tool, or Tinetti Assessment Tool, or I'm not sure what all it is called. Very nice. Invented by?
Mary Tinetti, and she's a physician. And where did you say she is right now?
Well, I know she had some involvement at the University of Minnesota. I don't know if she's still there or was there, but
Somewhere in this region of the country.
I'm from Minnesota, he's from Wisconsin.
Yeah,
so
she probably started at Madison, Wisconsin.
Oh, I bet. I bet. Anyway, why this might be of interest to you, if you have anybody that you know or yourself that you're having trouble with balance and you're worried that they may fall, that's what this test is to help try to predict. Very difficult to do, but we use it all the time. It's our probably most standard test that we use to see if someone's going to fall. What we'll do, it's not that you have to do the test, but we're going to show you components that might help you look at, your mom or dad and say, boy, he may be at a risk for falling.
Sure, and
So-
how do you have a quick little assessment just to get a rough idea?
Yeah.
But, as far as the Tinetti test goes, there's a score on it, and when we use it clinically, we have a score, and it's nice to have some objective numbers and say, as we take our test, we get 100%, we're real happy. Well, it's not so on the Tinetti. The highest score on the Tinetti is a 28, the lowest score would be a 0. And the 19 range, if you're at 19, that's kind of that gray zone where you could be, you're at that high fall risk too. Do you need a cane? Do you need a walker? Or, if you're down at the 5 and 6 range, chances are that person has been falling.
Has been falling already, and if you've fallen already, that means you are at high risk for falling.
Right.
I mean, that's automatic. If you've fallen already, you are at a high risk. And generally, I don't know if you run it this way, Brad, but when someone's at a 19 or above, or 19 and below, I generally think they should be using a walker or a cane.
Right. There are exceptions.
There are exceptions. There's always exceptions, but as a rule,
Sure.
I would say. Okay, Brad, I guess I'm going to be the patient, and you're going to be the clinician, and you're going to take me through it. And the first one we do is, I'll just read it first, each step.
Sure.
And then you'll determine how I do on it.
Okay.
Okay?
Well, it's divided into 2 sections, and the first one is
Balance section.
balance. So it's just looking at balance. And it's interesting because part of the balance is, people don't always think about it, is sitting. You have balance when you're sitting, you don't tip over in the chair, which, most people don't even think about that. But with people with trunk weakness,
We have people that are just that, or it says leans or slides in the chair, just having trouble maintaining their balance.
Exactly.
So you can get 1 point if you have good balance, and you have 0 points if you don't.
Typically, this test is for people that, elderly and 60 or 70 years old and older, or if someone has some weaknesses or some deficits, cerebral palsy, something of that, this would be adequate for, or just getting out of a surgery and they're still in that weak stage.
This is another good one, rising from a chair. We measure how well they rise out of a chair.
Right, and what we do is, this is how I do this one. I have them sit like Bob is, and I ask the person, can you put your hands together like this, and can you arise like that? And if they, sometimes multiple attempts, sometimes you cannot get up at all, and
sometimes they have to use
and if
arms,
arm rests.
or I guess this would even count as arms, right?
Yeah, if they're doing that, then I'm going to not dock them a half a point. Okay. We're not getting into those details with these people unless you're therapists.
What does that mean, Brad, though, if they're having trouble getting up?
Typically, it means strength.
Right.
Strength in the legs. They don't have the strength in the quads and the glutes to get up.
And if they don't have the strength in the quads and glutes, that means they are going to be at a higher risk for falling generally, because you get a lot of your balance from those areas. Could also be pain, which is the same thing. Pain can cause you to lose your balance if you have bad knees, bad hips.
Sure.
So.
And then once they get up,
we want to read the next section is attempts to rise, immediate standing balance.
right. So at that point, we just have the person look. Are they wobbly? Okay, yeah, if they're doing that, they got to catch themselves. That's going to change the score a little bit.
If they fall, which we always have a belt on when we're testing them, if they get up and they actually, they get 0 points then.
Right, exactly.
If they catch themselves, they get 1.
Right,
And if they're solid,
2.
2.
Okay.
Yeah.
So, and then at that point, I can go through, I got this memorized.
sure?
Oh, yeah.
All right.
I got it memorized, Bob. Don't worry about it.
I want to make sure he's right.
Bob, have faith in me. Okay, yeah, it'll come. Just, now, the next thing is you have them put their feet together, close together.
See, you're missing a section.
What?
You're missing immediate standing balance,
Yeah.
standing balance, narrow base. Oh, yeah, you're right. I thought you were going to do the nudge right away.
Well, of course not. Then it's feet together. Now this one, a lot of people, because of the girth of their legs, or if they're knock-kneed, they cannot get their feet to touch.
Right.
But you get as close
As you can.
Right. And then just stand there and see how they balance at that point. And then we go to I go to eyes closed. This is in order with the test, but this is the way I do it. Eyes closed for 3 seconds. Can you close your eyes, Bob? 1, 2, 3. And this one, you know, Bob is steady, but this really pops
That's
up
a lot of people.
Yeah, they close their eyes and they're grabbing.
Going back to even the narrow base one, Brad,
Sure.
very common for people to lose their balance on that one too. They're fine as long as they keep their legs apart.
Yeah,
But when you go narrow base like this, you're really relying on your ankles.
sure.
And a lot of people don't have that proprioceptive sense or
Yeah.
whatever, the sense of where they are at, and so
Right.
they really start swaying on this. And that means they're, because during the day, you're gonna have points where you have your feet together like this.
There you
know,
go.
when you're doing things in the bathroom or whatever,
Right.
so.
Exactly. Feet together again. And the next is a sternal nudge. And a lot of people, especially the older people, if they fall, backwards is the direction they're going to go. So we want to make sure they're steady there. So you go here and you just, yep, you just three nudges is what the test requires. A lot of times, if I want a little more, I kind of go outside the test realm and I'll push
That's what I do
in different
too.
areas.
I push in every
Yeah,
different
and at
direction.
that point, some people push me back and say, "What are you doing?" No, that happened when she got.
Did she?
Yeah, I had a woman. She got upset with me because she thought I was being rude. I didn't explain myself well.
But if they catch themselves, they still get a point.
Right.
If they don't catch themselves, and you have to hold on to their belt,
Right.
then they get 0 points. And if they hold strong, they get 2 points.
Yeah.
So-
Okay. Then the next one, eyes are open, and it's the 360-degree turn. Now this one, if you
legs
don't
are
want to know
apart.
it, yep,
Legs are
yep,
apart.
have them bring their legs apart. This is the one where I have nurses do. I say you don't have to know the test, but if you just want a good sense if the person needs an assisted device, a walker, or a cane, this is a really good one. Or if they can be in their house by themselves, turn around without touching anything, and if they can do that with confidence and you can feel like you don't have to do anything. Yeah, but if you're like here, a lot of times on this one I'll have another therapist or another person stand right there and I'm here and we have our arms like this. And we say, can you turn around?
They can go down and
Yeah.
then go down. The other thing, it needs to be continuous to get all the points.
Right.
If they're stopping,
Yeah.
that means their balance isn't as good as opposed to someone who can go like this.
Yeah, and
So-
another one, they'll pivot on one foot. You know.
Oh, sure, because they don't want to pick that foot up at
Yeah,
all.
they have one foot that's weak or there's an issue with it and they'll kind of favor that side. And then sitting down from there, can the person, and I'll actually have them do this just because I'm consistent that way. There, and if they're ploppers, if they plop down, it's no good. Weakness again.
Weakness or again, possibly pain.
Right.
Because you start getting
Sure.
that pain and it'll just, you're gonna plop right down.
And that's a real good way to get a back problem, compression fracture in some of
Oh,
these
yeah.
elderly people and they plop down in a harder chair.
Or they can miss the chair, which would be
Yeah,
disastrous.
yeah,
So,
yeah.
because they're backing up and
Yeah.
if they don't put their hand back there, they
Sure.
could slide right off it.
So that concludes the balance
Balance
section.
section,
And the total points you can get is 12.
is that right?
Yep. 12 on the top, 16 on the bottom.
16 on the
Oh,
top,
12 on the bottom.
12 on the bottom, yeah.
Okay, I got that part mixed up.
But you're glad I have this cheat sheet here, aren't you now?
Yes,
And the
yes.
next section is the gait section, or walking section, maybe to the layperson. And yeah, you can get 12 points on that. So, remember the first part? No hesitancy, so we're up,
Right.
we're up already, right?
Yep, after the person's up. In this one, depends on the person, you have to have a sense, do they need, sometimes you have a walker right away.
Right.
They're just not gonna be able to walk without a walker.
Yeah, you know that they're not gonna be able,
Right.
right, they're just gonna be so unsteady.
Right. So, but we're gonna do this without an assistive device.
Right, and so the first part is the hesitancy,
Hesitancy, yeah.
yeah. And where we often see that is in people with Parkinson's. They
Yeah.
just, a person with Parkinson's, just the way their mind works and the way things work, they just can't get the muscles to cooperate.
Yeah.
And so they can't get things going. I don't know of another instance in which that would be the case, would you?
Yeah, that one is certainly prevalent, where
Yeah.
you get that, they wanna go and you can,
Yeah.
and then finally they'll
Yeah.
start to get that shuffling.
And obviously that's gonna take away a point if they do hesitate,
Right,
okay? And then it's step length,
yeah.
okay? So then we're gonna look at walking.
Can you zoom down here, Nancy? So stride length or step length, why don't you set this foot here, Bob, and then freeze. So here's his toe line, I call this the toe line here. If this foot passes the front of the toe here, then that's what
So I should be more like this. I mean, I definitely pass it now.
Right, right. And this is where it gets kind of hard to judge, because a person's walking, you can't have them stop like Bob is
Right.
doing here for educational purposes. But that's if the foot passes the other foot, and if both feet pass the other
Right.
foot with a nice smooth motion, that's maximum point.
Yeah, you get a point there, you get a point there if you're passing.
But the person isn't doing that. As they're walking, we don't have enough room.
Right.
As you're walking, you have to take all this in. It just takes a little practice as a therapist. It's hard to do this right
But think
away.
about it, if you have poor balance, what are you gonna try to do? You're gonna try to keep your feet on the ground.
Yeah.
And you're not gonna wanna take long steps. You're gonna wanna keep real grounded.
Right.
If you have good balance, you can do things like this, and
Yeah.
take long steps, and you're balancing on one foot even for a while.
Exactly.
So the next one is, Brad, that's clearance, right?
Right, do you drag when you walk?
Yep. Are you dragging one of your feet or both of your feet? Or again, are your feet clearing, which means you actually have to balance on one foot for a while.
Yeah.
So,
Sometimes the toe will drag, sometimes the heel will come through and drag, and I'll count that off too.
do you cue people or not? Because so a lot of times I will ask people, can you take long steps? And they're able to do so, and then I'll just mark it down that I cued them, but they were able to do it.
Yeah, usually I just do their normal.
Do the normal walking?
Right.
Okay.
But yeah, I could see where that would be.
Because some people do it, some people have almost a habit,
Right.
it seems like they
Sure.
develop that.
Or if they got slippers on, their slipper drops off their foot and it drags.
Oh, yeah. Which is not that uncommon.
Right.
We've had trouble with swelling and such, so. Okay, where are we at now, Brad?
Oh, boy.
Path.
Oh, deviation.
Yeah, when they're walking, are they,
Yeah,
it's almost like a drunk pattern.
right.
So
In that one,
that also has the gate aid on there too.
right,
Yeah,
yeah, if they have a gate aid, you get a 0
yeah.
on that one.
If you're using any type of walker or cane, unfortunately, you get marked down right away.
Right.
I mean, because that's just how the test
Yeah.
is, so. All right, trunk, marked sway.
This is I don't. This
Yeah,
is
I
that
don't
one
either,
know.
too.
They talk about hands, I know what they're talking about, but I don't see that very
I
often
don't
usually
either.
on this one. I think we should, this is something that we gotta work with the test a number of times to get a feel for how
Yeah.
to grade that.
And then walking time, heels apart or
Right.
heels to.
In this one, you have to be in line, in the sagittal plane, we call it, in line with what's right in front of them or directly behind them. And the distance right here is what we're talking about. And you get the maximum number of points is when you're walking and your heels almost touch each other. That's good, that's normal gait pattern.
Yeah, someone-
Show the wide
Yeah,
stance.
somewhat bad balance, they try to widen their base so they're not gonna fall, so
Right.
they're going like this.
Yeah,
You see someone walking like this, you know they have often bad balance too.
Right,
I mean, they're
exactly.
trying to get them so these are things you can look at, your mother or father, if they're doing some things like taking a step and walking with a wide base, that means their balance probably isn't that good.
Right.
And can they turn around? Again, be very careful if you do this with anybody, I mean.
right, it's good to have two people, you don't
Yeah.
wanna cause an
Right.
accident just doing one of these
But
tests.
I would use it more on an observational basis. If you're seeing your parent
Sure.
do these things,
Exactly.
then you may want to have them go in and get tested to make sure
Right.
that there's nothing you can do, that there's not something you can do to help them have better balance.
Sure.
Or also, you're just gonna have to make sure that they maybe have a fall alert or some type of alert system so that
Right.
if they do fall, that.
They're not there all night long.
Yeah, exactly. So.
So once again, Mary Tinetti, she did an excellent job.
Yeah, thanks
on
a lot,
this.
Mary.
And what else can we say, Bob?
Well, we can fix just about anything, but we can't fix,
A broken heart, but we're gonna work on it.
yeah, we're gonna try to get that
Like
down.
a couple of those classes, I've been looking that up online, Bob,
Good for you.
some of those little studies.